Phoenix Home Care and Hospice. I choose Phoenix.
Hello, I'm Terry Tucker with Phoenix Home Care and Hospice. Welcome to this edition of Why It Matters. We have the show Why It Matters to help us learn and to help us celebrate those moments that life gives us. And I'm very excited about my guest here today, Tara Chandler. And Tara's a VP here at Phoenix Home Care and Hospice. But Tara is actually an expert in a topic that I am very interested in because of my parents,
Sure.
and that is Medicare. Now, I know this is a very important time of year. It's not just coming up on Thanksgiving and Christmas, it's open enrollment time.
That's right.
So what does that mean?
It's like deer season, open enrollment for deer season. So actually this is a great segment that I really am very passionate about. Two reasons. First of all, it's very important that the community is educated and know what options are available out there. But secondly, my parents. Unfortunately, my dad was switched to a managed care plan without his knowing, and we were kind of scratching our head going, how did this happen?
Right.
And it's concerning to me that people are not educated or aware of the ramifications if you do give away your Medicare rights. And
Sure.
So I wanted to be the advocate and the voice in the community to help support each other so they can
That's
understand.
wonderful.
Yeah.
And really all you're saying is educate yourself.
Absolutely.
Learn and find out what option is right for you.
Right.
And then when that option is right for you, you feel good about your choice because you know you made it from a place of knowledge.
Right. So open enrollment, great question. So open enrollment starts October the 15th and it ends on December 7th. So it's really a short window that you have time to enroll or change your Medicare benefit that will be applied for 2021. So it's a short window, and that's what we're here today to discuss.
So what do I need to know? I'm at a place where either I'm getting ready to go on Medicare,
Sure.
or I'm already on it and now I'm in open enrollment. What do I need to know? What are my options?
I think the first thing, and I'm going to go through the 4 top points of Medicare, A, B, C, and D.
Okay.
But the most important thing for me to educate over and over and over is Medicare C, which is your managed care, your Advantage plans, is a Medicare replacement. It is not a supplement. And I feel that is probably the biggest question that I get is people will state to me, oh, I have Medicare and it's Humana or it's United Healthcare or A, B, or C private company, and it's actually a Medicare replacement, not a supplement.
And for some people that may work.
Sure, absolutely.
So tell me, what does A, B, C, D mean?
Okay, all right. So there are 4 key points. A and B kind of go hand in hand. Part A is your Medicare traditional Medicare.
Okay.
That is your hospital visits. If you're going inpatient to a hospital, you're taking advantage of your Medicare Part A.
Okay, and everybody takes that.
Everybody takes that.
Okay, so what I've learned so far is everybody takes A. So now explain to me what is B.
Okay, Part B is for the physician appointments, your
Okay.
labs, any type of testing that you have to have done, your outpatient therapy. The thing that I really want to reiterate on your Part B is there is a monthly premium that
Okay.
you pay.
Okay.
That premium will be set for 2021, and they're looking at about $150 a month.
Okay, and everybody pays for B.
Everybody will pay for B, even if you're on a managed care plan, which is Part C. So if you have a Medicare replacement, you're still paying a monthly premium of $150 a month, but you do not get to use your Medicare Part B.
Okay, all
Yeah.
right.
So that's a little spin there that a lot of
Okay.
people aren't aware of.
Okay,
So Part C is
Okay.
your Advantage plan. Those are your Medicare replacement plans, your HMOs, your PPOs. The HMO and PPO, those are private insurance companies. So basically how that works is Medicare will pay the insurance companies for them to manage those Medicare patients. As an individual, when you sign up for a Medicare Part C plan, you are actually deactivating your Medicare benefit,
which is B.
which is A and B.
Oh, A and B.
A and B. So A and B go hand in hand, and then you've got C. So if you have C, you are in a replacement plan. The difference is with the C plan, you do not get to pick which physicians you want to go to. You have to stay in network.
Okay.
If you're on a Part A and B plan, you pick. So you can have any physician that you want. They're all in network. If you are in Florida and you have an accident, you go to a doctor there. It's in network. If you're traveling and you're on an Advantage plan, a Part C, and you go out of state or out of your area, and something happens, you become ill, you fall and break your hip, and you go to a doctor or a hospital, you would be out of network.
Wow.
So that would cost you more because you're going to be paying out
Sure.
of pocket for that out of network. If you're healthy and you're doing great, those managed care plans are actually
Because
a benefit.
your premium is probably lower.
Exactly. So from a premium stance, many of these managed plans are $0 a month for a premium, and some have a lower premium. So for those that are maybe financially strapped, living month to month, and they're healthy, that's a great benefit. They also will cover your vision, dental, and hearing. That is something that is not covered under Medicare Part A, although there are plans that are about $1 a day, so $30 a month, and you can have vision, dental, and hearing under
Wow.
your traditional Medicare. But with your Medicare Part C, your replacement plans, there is a $6,700 out-of-pocket per year that you have to hit. So you're still paying your Part B premium, and you have to hit your $6,700. Well, once you hit the $6,700, everything's paid for if
You're in network.
you're in network and if the insurance will authorize it.
Okay.
So now the doctor's no longer really your decision maker, it's the insurance company. So I will give a great example. We had a lady who had fallen. She had fractured her back. She called the ambulance to come pick her up. So she went to the hospital. The ER physician stated, you need to have back surgery. So they send in for authorization, and insurance stated, because she had met her deductible, the $6,700.
Okay.
So insurance stated she can still ambulate and walk. We are not going to authorize her for her surgery. Therefore, her ambulance ride, she had to pay out of pocket. Insurance wouldn't cover that either. So many times, unfortunately, if you're really sick, you want to make sure you're getting the benefit that you actually signed up for.
Right. Okay, that's A, B, and C. Now, what is D?
Okay, D is drug, pharmacy. So with the pharmacy component, definitely if you have a Part A and Part B, you want to sign up for D. Yes. So D is a plan that there's about 20 to 30 on average pharmacy plans. And actually there's a company that I'll reference in this video later that you can call, and you can give them a list of all the prescriptions that you're on, and they can formulate it into a system and tell you this plan is the cheapest for you versus the other plan.
That's great.
Just off of the drugs
Like a
that you are
consultant.
on. Absolutely. Some of your private insurance companies, your Part C, they incorporate pharmacy in theirs.
Okay.
So everyone's different.
Maybe you
though.
wouldn't need D then if
So-
you were on a C. Okay.
Yeah, but if you're on A and B, you definitely need Part D for pharmacy.
Okay, now is there something after D?
There is. We've got 3 more letters.
Oh my goodness.
F, G, and N.
Okay.
So if you are signed up for A and B, you will pay basically, well, let me start with A. So for Part A services, the hospitalization, you have a once every occurrence deductible that you have to meet. So you go to the hospital, you have to meet $1,408 deductible. After that deductible is met, then your insurance, which is Medicare, will pay 80% and you're responsible for 20%.
Okay.
Where the next letters fall into place is to pick up that 20%. So that is where you could pick up what's called a supplemental plan or a Medigap. Okay?
Okay.
So
That makes sense.
with your Medigap plan, those go hand in hand with A and B. They are managed by Medicare, so it's not a private insurance company.
So I can go wherever I want to go.
You can go wherever you want to go.
Okay.
There are about 10 different plans that you can look at.
Oh,
There's no out-of-network, there's no referral needed, so if you want to go to the pulmonologist or the oncologist or any type of
whoever your
specialist,
doctor wants to refer you to.
you don't have to have a referral.
Really?
So you just call the oncologist and make an appointment. With your Part C, you have to jump through the hoop and go to your primary
Referral
care doctor.
in the network. Okay.
So
All right,
that's one of
gotcha.
the biggest perks is you get to pick and choose who you want to go to. So there are F, G, and N. F is the first one. You just pay a monthly fee. There's no co-pays, there's no premiums, there's no deductible for your A and B. It's truly peace of mind. You get that 20% that you would normally pay for, and they pay 100% of that, so you don't pay anything out of pocket.
So there is a premium for that.
There's a premium. For the F, it's a little bit higher because it's kind of the one-stop shop that catches everything for you. The next one is a G. It's everything that falls in the F category, except for there is a one-time-a-year deductible of $198. So once you hit the $198, then 100% is covered.
Okay.
And then the last one is N for Nancy. Nancy's the same as G, except for besides the $198 deductible that you pay, you also have a $0 to $20 copay for your primary care specialist.
Anytime you go.
Correct. And so once you pay that copay and the $198, then they pay for everything. Also within that is an ER visit. It's a $50 fee or a premium that you pay for an ER visit. If you end up being hospitalized, they will count that towards it, the $50.
Okay. So, all right. So where can I go if I look at that alphabet and I go, I'm just kind of overwhelmed? How do I get help? Who can be my coach to tell me what's right for me?
Absolutely. I know you said I'm the expert. I'm not really the expert, so to say. So I work very closely with a gentleman named Adam. Adam is with a company called Medicare FAQ, Frequently Asked Questions.com.
Okay.
They are a free service. They do not charge at all. And they will actually walk you through all the steps and help you navigate which plan is really best for you and your pocketbook.
Wow.
They're the ones that I referenced earlier that will go through your drugs that you have to determine which D plan is best for you.
Okay.
So we will do a pop-up so you can see exactly how to get a hold of them as well, because I can't talk to every single person if they call in. I'm happy to help individuals if they have questions, but I definitely would hate to have someone think one thing. I want a real subject matter expert to be the one to navigate them through that process.
So I think it is a huge decision.
Absolutely.
If I get nervous about it and just don't act, that's my fault. I mean, this is up to me to reach out and ask for help. But I also know this open enrollment period comes every year, right?
Correct.
So it's not the rest of my life decision.
Absolutely.
And so I can wear it, I can try it, and see what's right for me.
It's just if you make a bad decision, you keep your fingers crossed that you're healthy.
It's a good year.
It's a good
and
year.
It's not a 2020.
And I think, exactly. I think really the other piece I want to hone in on today is there are a lot of television advertising. I watched last night even, I was hearing about all of these replacement plans, and they'll do this and they'll do that.
Lots of athletes.
One of them, they'll state, they will cover telehealth visits and they'll cover pharmacy delivery. Well, Medicare will also do the same thing. So make sure when you are comparing, you're comparing apples to apples. The other part with the managed care plan, they will state, we will do transportation for you, or grocery store, or take you to an appointment. They will on certain plans if you meet the criteria and if you live within a certain radius to cover that. So really do your due diligence, dig in, ask those probing questions so you really know what you're looking at, because like you mentioned, you're not in it forever, but a year can be a long time and a very costly time. Luckily, I have a situation of a family member that has gone through treatment after treatment, surgery after surgery, skilled nursing facility stay, inpatient rehab stay, home health multiple times, etc. Just a very tough year for 2020. And luckily this person has Medicare A and B and the F plan and has not received one bill. So that really speaks volumes to me, because if that person would have had a replacement plan, I don't know if they would have even covered all of the chemotherapy or treatment that person needed. So this is very near and dear to my heart, and I really, really hope people, especially if it's not the person themselves, the decision makers, those family members, those children of the sandwich generation, to help them navigate and ask those questions. At Phoenix, we are here to help as well. We want you to make good decisions and really understand what you're signing up for as well. So we can help as much as we can, but Adam is a great resource at MedicareFAQ.com.
Well, Tara, I thank you so much, and I'm sure our viewers thank you for just enlightening us a little bit on this very important time of year.
Absolutely.
Thank you for joining us.
You're welcome. Thank you.
And thank you for joining us for this edition of Why It Matters.
Phoenix Home Care and Hospice. I choose Phoenix.